Hello, my name is Dr. James R. Golding, and you're watching A Natural Healthcare Alternative, the program dedicated to your health, longevity, and well-being. Please stay tuned tonight because our topic this evening is headaches. We're going to discuss headaches, the different variety of headaches, and some alternative cures and methods towards helping people manage their headache and headache syndromes. Headaches are endemic in our society, and as I see and treat more and more people with headaches, I'm finding out that our modern day living and what's causing headaches is either allergies, stress, tension, hormonally related headaches, vascular weaknesses. We're getting more and more of them, and as a result, our society is continuing to take more NSAIDs, which is non-steroidal anti-inflammatories, which is inclusive of aspirin, Tylenol, things of this sort to help control the headaches. Now, it's not uncommon for people to individually get a headache once or twice a year, but I'm seeing people that have headaches all of the time, and they're taking medication to try to control these syndromes, where most of these aspects can be changed due to lifestyle changes and some of the natural therapies that we're going to talk about tonight. Those natural therapies include acupuncture as a treatment mode for headache syndromes. We're going to discuss chiropractic care with the involvement of chiropractic spinal manipulation, the use of stretching, and the use of the release of musculoskeletal trigger point syndromes. We're going to also discuss lifestyle changes and the possible use of clinical hypnosis to change the way in which your body reacts to stressful environments and conditions surrounding. What we're going to start out first with is we're going to start out first with our acupuncture component of the program and talk about different treatments and different aspects of the headache. Before we begin with that, we're going to take just a look at this chart for a moment, and this is a chart of trigger point pain and syndromes. Trigger point pains are what's called pain referral patterns due to a muscular or soft tissue tension that frequently radiates pain into the cranium and cranial areas. Sometimes people will have tension and pain in the masseter muscle. This is your jaw joint muscle. That may be the stem of a headache that may go on the side of your head. Frequently what we'll see is that people have a tension headache, and this tension headache originates in what's referred to as the suboccipital area of the neck at the base of the head and neck, and then people will get, quote, a neck headache pain, and that'll radiate up the posterior portion of their head. Other times, people will have allergy or sinus-related conditions, and regretfully, the air quality in New Jersey is fair to poor at most, so it doesn't take much more, especially as a seasonal change goes on, much more particulate matter in the air to really push over a person's allergy-related symptoms. So we're seeing more asthma, more allergy, and much more hay fever, much more seasonal allergy stuff. So what happens is that we need to use natural therapies to counteract that. But as we get sinus pressure and sinus pain, it starts to back up as we get sinus pressure, and then we get a frontal headache, and then that also involves this, the fronto-occipitalis musculature and can radiate pain to the lateral portions of the head. So our treatment mode today is going to be for treatment of frontal headaches, lateral headaches, or what's referred to as Shaoyang headaches in traditional Chinese medicine. We're going to talk about coronal or vertex headaches and suboccipital headaches, and the adjunctive role that the soft tissue plays around there, and how you can influence that at home, and how we can have an influence on it using these natural therapies. What we're looking at here just for a second is that this is a visual representation of the acupuncture points of the head and cranium. These points that are mapped out in this little guy here are ones in which we're going to needle to effecate the change of the headache syndrome, along with distal points in the hands and feet as we go along. We're going to look at some anatomy into the involved regions. What we're looking at is the spatial relationship between the first few neck vertebrae and your head and the pressures that they're going to put into that involved area. Sometimes vasoconstriction, meaning actual muscular constriction of the arterioles that are in the head. And using specific points in the head and neck, we can influence the diameter and the amount of blood flow going on into the head. So this is representing the blood flow that goes into the head. We have the spinal cord and the central nervous system involved in this region. Frequently, the temporomandibular joint or the facial musculature will be involved in causing headache syndromes. We're going to incorporate the use of not just traditional Chinese meridian-based acupuncture, but we're going to use a system known as auricular medicine. This is a form of medicine that has been electrically diagnosed as having reflex points to the interior portion of your brain. They've mapped out that portions of the vagus nerve, which is a large cranial nerve number 10, is that from the surface of the ear at given points electrically, when we stimulate those using acupuncture needles and or laser and or electrical response, we can affect different areas of the brain. We can control pain, we can control endocrine levels, we can control stress, we can influence a person's ability to sleep, increase their metabolism, decrease their metabolism, a whole host of things given the somatic representation. That means the external or superficial representation of what's going on in the body. Please stay tuned because we're going to go right into the treatment phase.
These kids are in trouble. They're not getting high on drugs or stealing. If they were, you'd do something about it right now. But why is it almost half of all parents who suspect their child has a problem learning wait a year or more before getting help? Why? Kids with learning disabilities are smart. They just learn differently. Call now. The sooner you get help, the better the chance your kid has.
With me today is Ms. Vicky, my entrustulated chiropractic and acupuncture assistant, who has decided to be our demonstration model today. Ms. Vicky, thank you for coming along. Now, when a person comes into the office for a headache-based syndromes, usually when people come to see me, before that they have gone and they've either done self-treatment and for years have self-medicated by taking anti-inflammatories. They may have gone to their family doctor due to having a characteristic migraine or tension or cluster headaches. There's protocols that are followed. Many times if this headache is frequent enough, we'll try to find out the underlying reasons for that headache, allergy testing. Sometimes we'll do blood work when a person comes in to see whether there's an underlying reason or deficiency of one sort or another. Sometimes a headache can be a cause or just an effect of what's going on functionally in the body. The good thing is that the vast majority of headaches are functional and not what's called organic. Organic means the person's getting that headache due to some type of secondary symptom from a disease or disorder. A person has a tumor, a person has some type of underlying health condition that's causing the headache. So what we're talking about is not that type of headache, which is a good thing that that's rare and not the majority. The majority are functionally based headaches, meaning people get these things in the absence of organic or disease-oriented processes, which initially when they come in to see us, we're either have been ruled out or we're going to rule them out when they first come in. What we really wanted to show today was the demonstration of how these headache syndromes, 90% of all headaches, can be managed conservatively. What we're going to start, and we've already started to do the initial needling pattern, this would be a headache treatment for either a migraine headache, which happens the majority of times more in women. A lot of times there's a big hormonal correlation between that. And this would also be a headache treatment for cluster headaches And I'm going to overlay, once we're done with that part, I'm going to overlay the treatment for sinus. All needles that we use for acupuncture are single-use disposable needles. And acupuncture treatment takes about 30 to 45 minutes. The amount of needles involved depends on the person and their condition. It can be anywhere from 6 to 8 needles. It can go up to 20 to 30 needles, depending on whether we're treating one or more than one type of headache syndrome, or one or more problems at one time. Let's say there's a menstrual correlation with when they get the headaches. Well, we may treat the menstrual problem as the underlying cause and the headache as the effect. So what we're going to do is we're going to start the needling process on Miss Vicky. Down here, the points that we've already needled are points, this is called liver 3 and gallbladder 41. These are points that even though they're down by the feet, they actually have there's some of the strongest point for headache syndromes. When we needle this and stimulate these points, frequently when a person has a frontal headache or a tension-based headache, they can actually feel that headache start to drain from their head as the process goes on. Usually points that really need to be needled are very, very tender in the acupuncture process. Acupuncture has its own form of evaluation dealing with, as we've discussed on previous programs, tongue and pulse diagnosis, palpation, meaning actual feeling of the underlying areas involved. This is a very important point we're going to needle here. This is called large intestine 4. It's one of the strongest points in the body. All acupuncture points are not considered equal. Some of them have much stronger effects on the body than others. We're going to be needling triple warmer 5. That's a point that deals with any immune correlation. So if a person comes in and has a sinus headache, we want to treat their sinus symptoms, but we also want to boost their immune system so that they have a higher response to the external airborne allergies or food allergies that they may have. These are points now that we're going to needle on the lung channel, because these will also deal with sinus-based headaches. Now I'm going to demonstrate some auricular medicine. Now that is the actual needling of acupuncture points inside the ear. Now, actually, acupuncture doesn't hurt. It's a very tranquilizing process. And sometimes the points will be slightly tender when I first needle them, and then a person will feel that dull out, and then they'll go into a very tranquil, relaxed state of mind and body well-being. Acupuncture is very similar to like an exercise program. We do more acupuncture points and we do more needling as we go along with the treatment as they become more accustomed to it. When can a person expect to see a change from acupuncture once they've started to get headache treatment? Immediately. Once we start the acupuncture process is when it's starting to happen. For chronic headache-based syndromes, a person may need a few treatments before we start to influence the nature of the underlying headache syndrome, especially if it's menstrually related. The average number of visits or amount of treatments involved in headache, when we take all headache syndromes across the board, is usually about 6 treatments. Acupuncture treatment is rendered usually at a frequency of twice during the first week, and then once a week for a 3 to 4 week period of time. If a person needs any supportive care, then they get it. Like a lot of times people will come in with sinus-based allergy conditions or sinus-based things that they may get seasonally. Once we go through that initial regime, the person may not need any more treatment, or let's say September is coming up and it's hay fever season, we may render a singular treatment every August. It kind of reboosts the immune system to help with these sinus-based symptoms. And what we'll do is when the sinuses are really active, we'll needle for direct sinus points. And during the course, like if a person comes in and they have pressure in these sinus regions, These points will actually, and the sinuses will actually open up during the course of the treatment. It's pretty amazing. So when a person leaves the office, the positive feedback loop is already in place. What we're going to demonstrate now in Chinese medicine is known as Shaoyang headache. Its Western correlate would be a lateral headache along the side of your head. Frequently, people with one-sided migraines may get more tension into here, or a tension-based headache. What we do is we're still going to do the distal points. These are the points that we've done in the extremities, at the feet and into the legs. Keep in mind, these are very, very powerful points for headache. Now we're going to be doing a lot of needling that deals with right along the cranium, along the side. We're going to be doing our auricular-based medicine. And what we're doing is a combination of traditional Chinese acupuncture points, and also we're actually doing trigger point releases of the musculature and the fascia. That means the actual coverings in and around the cranial bone. We'll also, before we start to do the needling in a condition like this, we will check for cranial faults. That is do something called applied kinesiology. It's to check to see whether the movements within the cranial bones are moving in with the respiratory cycle. Fixation or areas within that respiration that are stuck need to be separated, and actually cranial bones can be manipulated just like we can manipulate the bones that deal with the cervical spine and into the back itself. This characteristically is a treatment that we would use similar if a person had facial shingles or chronic long-term facial neuralgia, tic douloureux, if they had Lyme's disease that also caused facial neuritis. There's very similar treatment that we would use to decrease inflammation and bring back the nerve supply back into that area. By and large, one of the most common headaches is the tension headache, which outweighs everything by a mile. What we're going to demonstrate here is the component between the aspect of this headache, what we refer to as the neck headache, and its referral tension to the base of the head and neck. It also closes down on the blood and nerve supply in the head and neck. In our society, with so much excess and corrupt tension, what we do is all of these muscles start to draw everything up tight, and it goes from tight to tighter to tightest to closing up everything. And then it creates myofascial muscle patterns, meaning muscles that are held so tight for so long that they actually don't know how to release. And even though you may relax and sleep, it goes into chronically same pattern. So there's actual points where when we press them or apply pressure, they start to radiate up into the headache area. And that's the reason why, too, you may find on yourself when you apply pressure to certain points, oh, it starts to give it a little relief. Well, in doing it with acupuncture, it gives it big time or major relief. So what happens is I already start the process a little bit, and what we see around the needles here, see this looks like a little bee sting? That's called a hystemic response. That is the optimal response to the needling process for acupuncture for this condition of headache. What happens is that we'll know when to take the needles out when this hystemic response or reddening response stops. So what we're going to do next is that we're going to needle directly into the suboccipital musculature. These are the small control muscles at the base of the head and neck that are frequently get bound up. These areas on a lot of people don't even know how to be loose. So they need to be retrained by breaking the tension, the cyclotension, as I call it, and the actual trigger point processes and reset the spindle cells, the control cells in the muscles. A lot of times people will have headache syndromes because they don't allow for enough rest and sleep. One of the most effective points is this one right here. It's called Omnion, and that is a point that is for insomnia and helps to allow for sleep. This point itself, like if I were to just choose one point to needle for this particular type of tension pain syndrome, it would be this point. This is called DO13, and it is a meeting point of what they call all the yang energy cycles in the body. All of the electrical cycles that deal with the electrical system of the body meet at this point. If I just had 20 to 25 minutes to be able to manipulate this point with the needle itself, I could usually break most headache syndromes. Just like a sewing machine, I take that tension right out of there. What we're going to do next is, I want you to stay focused because Dr. Kirsten's going to be with us, and we're going to discuss the chiropractic aspect to well-being.
By keeping my car regularly tuned, I save money on gas and repairs. That also means cleaner air. You know, feels good to help save the cash, planet.
Environmental defense, Get Green. For more tips, go to getgreen.com.
Without further ado, the illustrious and mysterious Dr. Kenneth Kirsten.
Thank you. Okay, as Dr. Golding explained and went into great detail about the description of our headaches, we're going to get into the chiropractic portion and a little bit of home care for our headaches. Well, we're going to deal with headaches in all forms again, and then when people come to our office, sometimes they receive just chiropractic, sometimes they receive just acupuncture, but many times they receive both. And this seems to be the most beneficial type of treatment for most headache type syndromes because these headaches have been so chronic, they've been there for such a long time. So a lot of times it takes a little while for these headaches to make improvement, but usually we see very, very quick results. So we're going to address the musculoskeletal component of these headaches, or the muscle tension type of headaches, or the cervicogenic type headaches first. So after doing a complete exam and finding out what our baseline of our headaches are, we're going to palpate, which means we're going to feel for tender points and these trigger points in the back, in the neck area, and the suboccipital muscles. And what we're going to find is we're going to try to find if we can spot it, you got it. So we're going to try to find those points that actually refer or actually reproduce the headaches or relieve the headaches. If we could put our finger on it, that means we know we can assist it. It's provocative pain. That's the kind of pain we want to see. Those would also indicate that these headaches are non-organic. So what we would do is we would do some, either the seated position or the lying position, we would just do some ischemic compression, just applying our thumb deep in to points along the trapezius muscles or wherever we find these referred points. And we would put just some deep pressure, and what the patient will feel, I'll have them feed back to me, is that it really hurts of reproducing the headache or relieving the headache, and then they start to feel the pain start to fade away after about 10 seconds. And then I'll dig deeper again, and then we could eliminate these trigger points. That's one. After palpating or finding cervical restrictions from motion palpation, which means we're going to palpate the neck in a seated position and lying down position, and we're feeling for rotational fixations, extension fixations, which means that this feels like this joint is just stuck or jammed. And that's when we require a manipulation or manipulation to the cervical spine, or movement or mobilization to these areas of the cervical spine. And a lot of times with that, you will feel immediate relief from upper cervical manipulation or just mobilizing these areas. So Vicky, I'm going to have you lie down on your back. And this is the most relaxed. A lot of times when people will get into this position, they can feel the neck musculature will relax, so it's easier for me to palpate and feel the tension in the neck. And I'll get on a point, and I'll feel, does this hurt here? I'll know exactly where they hurt, and they'll say, how did you know where that was? Because I could feel it. I could feel the restriction range of motion in here. And what we'll do is we'll just stimulate a little manipulation to that area and cause that area to move. It's like kicking a door that's jammed shut. We're going to make it fly open and allow that for full range of motion to come back, and then I'll get right back on that point again, and the people will say, oh my God, the pain's gone. It feels much, much better. So a lot of times I'll feel back here, they can get those reproduced pain that comes all the way up and around into the headache, around to the side of into the ear, up into the nose, behind the eye. And these are the very common points for migraine headaches. Now with migraine headaches, they're vascular headaches, okay, which means that the mechanism is going from a constriction to a rapid vasodilation or opening of those blood vessels that go up into the head. It causes all this pressure, and we have these severe migraine headaches. The best time to get chiropractic for a migraine headache is in the classic migraine or the prodrome, or when the people sense that they're feeling this headache come on. They either get tunnel vision, they get floaters, they get nausea about a half hour or an hour before the real headache kicks in. The problem is a lot of times we can't just run to the chiropractor whenever we want and get this treatment. But that's the time to get the treatment. That's when we can actually even maybe stop a migraine or really, really limit the migraine. Once the migraine is full-blown, we're trying to manage it and decrease that pain and reduce the muscular tension component of it, because the people have usually photophobia, where they're bending their head down, they're getting all the tension, just like Dr. Golding was saying before. So we're trying to manage the situation. So with those situations of migraines, we really want to hit the transition zones. What that means, we want to hit C1 and the occiput here, which is the base of the cervical spine, right where you can feel the ridge, right where the base of the skull here, that first, we can get off and come right onto the first cervical vertebrae here, C1. And every time, there's not a time I haven't felt that this area right here is severely restricted in a migraine, active migraine. So I definitely want to manipulate that area. And then also the cervical thoracic junction, right where the curve of the neck changes into the upper back. Those are the two transition zones we want to hit. And we want to manipulate those areas. And just by doing those or stimulating those areas, it seems to really relieve the migraine before it either gets there or when they're having it. Now, for the last headache, or the sinus or allergic type of headache, we really want to manipulate, actually, the skull, the head, and all the sinuses. And we can do that by just putting pressure in here. Many times people feel that they just have, like, their eyes are full, or they feel fullness in the head. So what we need to do is we need to stimulate those areas. The sinuses are pockets, and a lot of times with chronic sinusitis, it's just from lack of drainage and lack of flow and lymphatic drainage. We need to stimulate that area and just get it going. So I'll get it right in here, and I'll put my fingers right in here and press into the face here, and they're like, I could feel it so much better. And by doing that, I'll just stimulate that area, and I'll press and then release, press and release. And then I'll even have the patient breathe in and then breathe out, and separate the nasum here and breathe out just like as they're breathing out, and they can feel the sinuses opening up. Just like when people wear the breathe right strips, so they put those tapes across the nose. You see the athletes, it helps them breathe. And what we're doing is we're assisting or facilitating in that. So I'll have the patient, put pressure in here at home. I'll do them here. I'll tell them to rub down here. For the suboccipital headaches, I'll tell them to lay on the tennis ball at home just to put some pressure in there to help with that. And a real good trick for migraine headaches for home, for people you can use, ice. Ice is the first thing you want to use. You want to use ice on the back of the skull, and you want to heat the hands, and you want to draw that blood or make that vasodilation come down to vasoconstriction and bring the blood away from the head. That is a good trick to help with migraine headaches at home.
Chiropractor extraordinaris, Dr. Kirsten.
Thank you.
For Natural Healthcare Alternatives, I'm Dr. James R. Golding, and thank you for watching.